Welcome back to our monthly Health Matters chat. So my name is Matthew Zang. I'm a health educator here at LAHC, and my guest expert today is Christina Dawkins. I'm going to let her introduce herself.
Hello, I'm Christina Dawkins. Like Matthew said, I am a public health consultant for the Michigan Department of Health and Human Services Heart Disease and Stroke Prevention Unit. I've been here for about 10 years. I really like my job. I get to do a lot of interesting stuff and read a lot of research and new guidelines. And I love helping the public around cardiovascular issues. Also, this is February, so happy Heart Month.
Yes, happy Heart Health Month. So our Health Matters chat, every month we have a different topic, and because February is Heart Health Month, that's why we chose to add our health topics. So for our first question to start this off, what is what are cardiovascular diseases in general?
Yeah. So breaking the word down, cardio, and we have vascular. Cardio refers to the heart, and vascular refers to all of your veins and arteries that pump the blood to and away from your heart to all organs in your body. So summing it up, it is the way that the oxygen and nutrients and fluids are transferred throughout your body.
And so what would a cardiovascular disease, what does a disease in the cardiovascular system look like?
Yeah. So cardiovascular diseases are a group of disorders that affect your heart and the blood vessels, those arteries and the veins. These can include conditions such as coronary artery disease, heart failure, strokes, arrhythmias, peripheral artery disease.
What are some of the risk factors that might lead to some of these conditions like strokes and our other like cardiovascular diseases?
Two of the main conditions that we focus on in the state, at the state government level in public health, are blood pressure, high blood pressure to be specific, and high blood cholesterol.
So high blood pressure we might be able to kind of infer what that means, but just to cover our bases, what does that look like and what are the symptoms of that?
Some other risk factors include smoking or breathing secondhand smoke, not engaging in any type of movement. Physical activity is often what we'll call it, but basically just move your body. Not eating a balanced diet. And then another risk factor is maintaining a healthy weight. All of those risk factors I just mentioned are what we call modifiable risk factors. So there's things that you can do to help prevent or to help lower your risk of having a cardiovascular event. There are also some risk factors that are not modifiable, and that includes age, race, or ethnicity. We know in the US that some populations have a higher risk factor for cardiovascular disease, morbidity, and mortality than other populations. That pretty much sums up the non-modifiable risk factors.
Gotcha. So all of these risk factors are things that, well, some of them are things we can change that we want to work towards reducing that risk. And then, so for the non-modifiable, we just kind of have to learn to live with that and hope that or work towards the lowest risk that we can get with our modifiable ones. I do want to go back really quickly. Just as a general or maybe a micro view, what is cholesterol? Because we hear about this, we hear about it in eggs and all sorts of other foods that we probably eat either every day or many times a week. So what is cholesterol? You told us that it can build up, but what is it actually?
I think it's always important to note that cholesterol is a type of fat that is necessary for the body to have in order to function properly. it plays important roles in creating cell membranes, in production of hormones, and digestion of food. But too much cholesterol can increase our risk of developing cardiovascular disease, such as heart disease and stroke. But in the blood, when we're talking about blood cholesterol, there are two types. There's low density lipoprotein cholesterol, and then there's high density lipoprotein cholesterol. So it's the LDL is often referred to as the bad cholesterol, because that's the one that contributes to the buildup of plaque in the arteries. High density lipoprotein, or HDL, actually helps to remove cholesterol from the bloodstream. So it is definitely not necessary to eliminate all cholesterol from your diet, but it is important to be mindful and to focus on healthy fats. So dietary, like you pointed out with eggs, like dietary cholesterol is found in animal-based proteins such as meat, fish, poultry, and dairy products. And then there's plant-based sources of fat, such as nuts and seeds, avocados, and those are generally healthier fats, generally speaking. But it is important to limit saturated and trans fats, such as Oreos. I have a real weakness for Oreos, and I just try and keep them out of the house if I can. But I have no shame in eating a couple of them. I just put it as part of a overall healthy diet and making myself move.
Yeah, that's what we tell everyone that we interact with here at LAHC. We don't want to cut things completely out of our diet. We just want to be mindful of how much we're eating and all of the different things that we're eating so that we can make sure that everything is in the right moderation.
Yes, absolutely.
So another question is there an age where we should start becoming more aware of our cardiovascular health, or should we just start as soon as we can?
So the earlier that we can start taking care of our bodies and being mindful of, how we are, listening to our bodies and treating ourselves good, the better. Because then you won't have to play catch up quite as much when we're older. But if you're older, it's never too late to say, we can do what we got to do now. Every day is a new day to make a different decision. If you're 45 and you're male, then it is about that time you really should be paying more attention to your cardiovascular health. For women, the age recommendation is 55. So with that will come more routine screenings and monitoring.
So what are some of the symptoms of having a cardiovascular event, and how quickly should one see a doctor after experiencing one of those symptoms?
Some of the signs and symptoms of a heart attack include, like, more commonly, right, chest pain, tightness, squeezing, aching feeling. You can have discomfort that spreads from your shoulder, your back, your neck, your jaw, teeth. Sometimes, the upper belly. It can sometimes feel like heartburn or indigestion. I used to work in an emergency department, and that was oftentimes one of the things that people would come and say, I just thought it was indigestion. I just had heartburn for so long. Sometimes it was just indigestion, and sometimes it definitely was not. And some other signs and symptoms of a heart attack include cold sweat, fatigue. So if your pump is not pumping like it should be, then you're getting more tired easier. You can also have lightheadedness, sudden dizziness, nausea, shortness of breath.
You were speaking about fatigue. I know my father actually had fatigue when he was mowing the lawn one time. and we didn't know any of this good information. So he actually drove himself into the ER or into the doctor, and
Mhm.
turned out he had a 99% blockage in his main artery.
Oh my gosh.
He was fine. Everything got worked out, but definitely taking those little signs, even just getting more tired of basic tasks while you're doing basic tasks or those kind of things. Yeah, it's
Mhm.
definitely important to listen to your body and respond quickly and as best you can in those situations.
Yes, absolutely. And we don't have the diagnostic tools at our home necessarily to be able to see these things, but our primary care provider is a great resource. Or if you have a nurse practitioner or a community health worker that you work with, they're also great to talk to. I really love my pharmacist because they sometimes seem to have more time for my questions, um, than I think sometimes my primary care provider does. But all of those are great resources, and I'm glad that your dad went in to see his doctor versus like just trying to sleep it off.
Yeah, that was definitely very fortunate. Well, Christina Dawkins, thank you so much for being on our program. It was an absolute delight having you. So that will wrap up our health matters for this month. So thank you. I really appreciate you being on our show.